And everybody telling wonderfully well. Answer is Gardnerella vaginalis, and Amsel's criteria is there. The pH goes more than 4.5, and you can able to see the clue cells here. And when the discharge is the greyish white one, that is fishy only, fishy smell. And when you put a 10% KOH in that whiff test, it enhances that fishy smell. So that is what is Amsel's criteria. And drug of choice, Kayur have already told up, metronidazole. Okay, and in pregnancy also, Kayur, answer is metronidazole. Favorite question examiner must have suffered from bacterial vaginosis. Pushpendra have written everything right. Very right. Good. Good. That criteria, you know, Amsel's criteria. Can you tell me another criteria which was used to be used before? What was that? What was that? Anybody? And if you answer that again, 200 above. Pawan, wonderfully, yes. Nugent score. You are right. You are right. पवन तुम्हारे आ रहे हो भैया 200 से ऊपर इस बार, अगर FMG में हो तो, नहीं तो नीट PG में पास तो ही रहे तुम बढ़िया से. हाँ जी delirium, you are right. In trichomoniasis also metronidazole. Strawberry cervix, strawberry vagina in trichomoniasis. Good guys. Okay, moving. Now, see this particular one. There is a formation of eschar at the site of mite bite. Identify the causative agent. Mite की बात हो रही है और causative agent पूछा है. Okay. So guys, we are talking about which particular disease? We are talking about scrub typhus. And scrub typhus is transmitted by mite and done by what? Aurantia sussugamusi. पुष्पेंद्र डेलीरियम ने बहुत ज़्यादा पढ़ लिया है. More than 7 they are telling for the Nugent. Nugent अब यूज़ ही नहीं करते, इतना कॉम्प्लेक्स है वो. Eschar at the site of mite bite, identify the causative organism. Scrub typhus is the disease and the organism is Aurantia sussugamusi. And in this, important is that if you are having in the history a black eschar, a rash, okay, and a hilly region history, these all features are there. Okay, they talk about this and they talk slightly regarding the Weil Felix test. Weil Felix test is OXK, strongly positive. Scrub, like this you remember, no? Scrub typhus. Ivermectin कहाँ से आ गया मनीषा? Ivermectin किसके लिए यूज़ करेंगे? हैं? अरे नहीं भाई, बुरेलिया कब से कुटीने लावा माइग्रेन्स करने लगे पवन? अरे डेली इस बार तो तुम पास हो यार, टेंशन मत लो बिल्कुल भी. फुल कॉन्फिडेंस से जाना, विद फुल कॉन्फिडेंस. OXK is strongly positive and Abdul, you are right, it is also termed as chigrosis. Okay, chigrosis. Weil Felix test is which type of a test? First of all, tell me this. It is heterophile agglutination test. Which is the other example of heterophile agglutination test? Paul Bunnell test. Okay, tell me in the comment section, Paul Bunnell test is done for. बस केबीज नहीं है भाई. इश्कार कहाँ मिलता है इस केबीज में? डॉक्सी ड्रग ऑफ चॉइस. यस यू आर राइट. मैं बोला ना डॉक्सी ऐसी, इन दोनों में से कोई भी गैस कर दो, आंसर तो होगा ही वो. राइट, बताओ. Which other heterophile agglutination test you know? Anybody? If somebody tells up this, 180 marks this time. Tell me. Paul Bunnell test. Preeti, you are passing this time. Okay, Paul Bunnell test. Paul Bunnell test is done for which particular virus? Infectious mononucleosis, yes. Which particular virus does it? Epstein-Barr virus. Okay, very good. Epstein-Barr virus is which number, guys? HHV4. Human herpes virus 4. Okay. So these are important ones which you should know. And as such, if I talk about the Rickettsial family members, epidemic typhus, endemic typhus, Rocky Mountain spotted fever, Indian tick typhus, Okay, rickettsial pox, these all are important diseases, and you should know regarding their causative organisms. Drug of choice for all of them is doxycycline, that is also there. Okay, and in this rickettsial family only certain fellows they come like Bartonella Hanslet, which leads to cat scratch disease, which used to come before, but now they are telling that they're different in some characteristic. So Bartonella Hanslet is one of them, important. Cat scratch disease has been done by that. Stellate granulomas, done by the scratching of the cat. Haste the cat has scratched you. Bartonella quintana, that leads to trench fever, and both of them they lead to what? Bacillary angiomatosis, which is a type of a vascular tumor like Kaposi sarcoma, and obviously common in whom? In HIV positive one. And one is Bartonella bacilliformis, which leads to Oroya fever. That also is there. Okay. Lithium causes it. और भाई तू कैसी कैसी बातें कर रहा है, क्यों रहा है? लिथियम क्या करने लग गया? Delirium, you are right. CMV choose for 5 years. And Epstein-Barr virus, that is HHV4. ये है, इतना इंपॉर्टेंट तो नहीं है, लेकिन हाँ बाई चांस पता लगा किस्मत ही खराब उस दिन, तो यू शुड नो एंडोफ्लैजिला ऑफ ट्रिपिनोमा पैलिडम. Trypanosoma pallidum is not having a true flagella, it is having an endoflagella which arises from the periplasmic space, and this Trypanosoma pallidum is having which type of motility, guys? Corkscrew motility. Okay, it is having a corkscrew motility. Now talking about fungus, some of the fungus we are talking about, and in this particular fungus, obviously these names suggest that we are talking about what? We are talking about dimorphic fungus. We are talking about dimorphic fungus. What dimorphic fungus? Dimorphic fungus exist in yeast as well as mold form. Mold is gold. How much carat gold? 25 carat gold. So 25 degrees centigrade. And yeast at which temperature? Body temperature 37. So that you already know. Okay. So this is a dimorphic one. And let me explain up the important points in dimorphic fungus. And if you make it zoom one. So blastomyces. The important point regarding blastomyces infection, blastomycosis, is it is having figure of 8 appearance of the yeast cell. It looks like a figure of 8 or broad based. Coccidioidozymitis, it is having this arthroconidal arrangement, and there is a spherule which have endospores inside. Histoplasma, it is having a tuberculate macroconidia. Remember guys, histoplasmosis is now a favorite of NBE. They can ask you again this with this particular feature, and this is termed as tuberculate macroconidia. Looks like a sunflower. Okay, and histoplasmosis, what they are asking is that chronic histoplasmosis mimics TB, because cavity forms in that, and in TB also cavity is there. That is important point. And there is a narrow base budding like this. This is termed as narrow base budding in that. Okay, and these narrow based yeast cells, these budding yeast cells, you can find in the bone marrow biopsy, guys. In the bone marrow biopsy of these individuals with a traveler history, if they are coming up in your exam, they are asking regarding that, they are asking regarding the histoplasmosis, which is also termed as OYO disease. Okay, OYO disease, and this is also termed as Darling's disease. Yeah, everybody is telling in the comment section. Good, wonderful. Fine. So if they are talking about bone marrow biopsy and they are showing up the narrow base budding yeast cells, they are talking about histoplasmosis, one thing. And if they are talking about traveler history and they are talking about the bone marrow biopsy, and in that bone marrow biopsy they are talking about the kinetoplast, okay, and some nuclear stuff, and they are telling that the color is changing black, they are talking about Kala-Azar, amastigoid form. Remember that thing also. Okay. Paracoccidioides, this particular one, Paracoccidioides brasiliensis, it have Mickey Mouse appearance of the yeast cell. Mickey Mouse appearance, mariner's wheel appearance, that is typical of this Paracoccidioides. Sporothrix kinki, sporotrichosis, rose gardener's disease. This is termed as flower-like sporulation, the mold form, and this is termed as narrow base budding. What we are talking about, guys? We are talking about dimorphic fungus. Okay, we are talking about what? Dimorphic fungus. Medical expert, पढ़ लो अब तुम, ठीक है? So these are what, guys? These are the Dimorphic fungus. Fine. Now, talking about this particular thing, that Zygomycetes. What is the other name of Zygomycosis? Tell me that. What is the other name of Zygomycosis? It is also termed as Mucormycosis. Okay? Mucormycosis. Yeah, very right, Abdul. It is lymphatic spread. Sporotrichoid pattern is observed in that. Okay? And these particular features are there. Asteroid bodies. Wow. सब याद पड़ा है तुम्हें. Good. Mucormycosis is the other name of Zygomycosis, and the third name is also important. They have asked this time by that name, Phycomycosis. Okay, Phycomycosis is the third name of Mucormycosis or Zygomycosis. Septate hyphae or aseptate hyphae? Aseptate hyphae, obtuse angled. Okay, aseptate hyphae, obtuse angled. Fine. And obviously mucor and all, it's common in DM fellows, diabetes mellitus fellows and all that you already know, and COVID-19 history they can give you, and after that steroid use and all that, and you should know regarding it. So this is having aseptate hyphae, obtuse angle or right angle stuff. Pheoid, if this particular name comes, right, pheoid and all, this is termed as pigmented fungus. This name also can come in the exam, pigmented fungus, okay, darkly pigmented ones. And they are termed as melanized fungus. And these pheoid only have certain names which are termed as black fungus. So remember this particular point for your lifetime. Black fungus is not mucor. Okay, black fungus is pheoid fungus, and pheoid fungus are darkly pigmented ones. Let me tell you an example of this: Chromoblastomycosis, which we are talking about now. So in which you have those medullary bodies and all that. That family is having certain fungus which are black in color. So that's why they are termed as what? Black fungus. Curvularia. You're right, guys. Ajay, very right. The drug of choice for that is often asked question, LAMP. That is liposomal amphotericin B. Okay, guys, let's move. This, we're just talking about the pheoid now. This is that pheoid one. Melanized. If this word comes, a melanized one. So we are talking about the pheoid fungus. Okay, Chromoblastomycosis we are talking about, and this particular appearance is termed as what, guys? Copper penny appearance. Copper penny appearance. What is the other name of it? Medullary bodies, sclerotic bodies. Okay, and the mnemonic for that is what? MSC. That is medullary bodies, sclerotic bodies, and copper penny appearance. Favorite question examiner. Must have suffered from this particular disease. It will become favorite of that particular fellow, and they are asking up again this particular one. Okay. Now, which fungal infection is this? Which fungal infection is this? Yes. This was also asked in the last exam. This is strawberry-like. Yes. Cortex sclerotic body is a favorite question of examiner. Must have suffered from it. What is it? This is polyps. Okay, strawberry polyps, nasal polyps, unilateral, bilateral, both. And it is rhinosporidiosis done by Rhinosporidium seaberry. Okay. And what you get in the biopsy of it? A spherule within that endospores. Drug of choice, somebody is telling up in the exam, like in the comment section, Dapsone. Manisha also told that it is non-cultured. Yes, all these points can be asked for sure. Okay, the chat is also like informative. Good. Now, tell me about this one. What is this particular test all about? Sean test. Which particular test we are talking about in this? Aquatic protozoa. Very good. This is aquatic protozoa, not the fungus. Yes. Which particular test we are talking about here, guys? This one. This is germ tube testing, also termed as Renault Broad phenomena. And it is being shown by which fellow? Candida albicans. It is shown by which fellow? Candida albicans. Germ tube testing. It produces germ tube formation. Okay, and along with that germ tube formation, it also produces these types of spores which are termed as chlamydospores. And chlamydospores are produced on a nutrient deficient media termed as corn meal agar. Okay, and here I like to ask you a question. Beta-1,3 glucan testing. This particular beta-1,3 glucan testing, what was the mnemonic of it and what is there in this particular cap? In this cap you have this candidiasis, okay, then you have this aspergillosis, and then you have this Pneumocystis jirovecii. It is not done for the Cryptococcus, it is not done for the Mucormycosis, it is done for the cap. Okay, it is done for the cap, and important is these are invasive ones. Invasive candidiasis, invasive aspergillosis, and this Pneumocystis jirovecii. This is also a favorite of examiner, must have suffered from any of these diseases, and this question is a frequently asked one. Now, what is the drug of choice for the invasive aspergillosis, guys? Answer is voriconazole. What is the drug of choice for candidiasis? As such, azoles, that is the fluconazole and all. And if that thing is resistant sort, then you can go for amphotericin B and all. Very right, wonderful Delirium, wonderful Preksha, wonderful Manisha, wonderful Pushpendra. You are all rocking. Now tell me, which particular staining is this? The background is dark and against that this capsule is shining off. What we are talking about, guys? Yeah, tell this one. What is the staining this known as? Which type of staining it is? Tell. Which type of staining it is? Negative staining. Very right, Manisha. Very right, Daffodil. It is Indian ink staining. Indian ink staining is a negative staining in which the background is stained, and against that you can see this particular thing as capsule, and this capsule is virulent, and because of that virulence only it could enter into the meninges in the HIV positive ones. Most common cause of meningitis is Cryptococcus neoformans, and we are talking about that only. Okay, and for that latex card agglutination test is also available, which is better than this. This have also come because in that you can find out what cryptococcal antigen. And what's the drug of choice for cryptococcal meningitis? LAMP, along with flucytosine. Okay, along with flucytosine. Can we do beta-1,3 glucan testing here? No. For crypto, we can't do. Okay. Now this one, the favorite line, dichotomous branching of hyphae. That is a typical of which particular fungus? The answer is obviously Aspergillus, and it is having septations, and this is a sort of dichotomous branching at an angle of 45 or at an angle of 60 degree. That is what is the feature of this. No, stain, Pushpendra, that is not a stain, that is a test. That is the card test, latex card agglutination. Aspergillus is the answer, dichotomous branching of hyphae, and Aspergillus is having septate hyphae, dichotomous branching. The angle is acute angled, obviously. Dichotomous means that only 45 or 60. And important is those names: Aspergillus fumigators, Aspergillus flavus. Flavus secretes aflatoxin. Aflatoxin responsible hepatocellular carcinoma, found in groundnut workers also, that particular thing. And Aspergillus niger does otomycosis, blackish crust, and those particular aspergilloma, ABPA that you already know. Okay. And invasive we have just talked about. Invasive aspergillosis, drug of choice is voriconazole, and for that we go for the beta-1,3 glucan testing and one more name, galactomannan testing. Galactomannan testing is also being done for that particular Aspergillus. Okay. Now guys, this is a hot favorite of examiner. This might be seeing up in the exam. If they are showing up this, that is the crushed ping pong ball appearance, which are black colored, and the stain name is gomerymethamine silver stain, and obviously written up there the states of what, Pneumocystis jirovecii. This question might come in your exam. Okay, and in this you have perihilar opacities on the X-ray, and lobes are not involved. If at all they are involved, upper lobes are involved up in this. Pneumocystis jirovecii pneumonia happens to be in HIV positive at the CD4 count of less than 200, and drug of choice for this is cotrimoxazole. This is also not cultured on SDA. That's why we don't consider it also as a fungus. Okay, it shows features of both, but still we don't consider it because it is not cultured on SDA. And this name of the stain is important, Gomori methamin silver. As such, it stains G for G, green, but the cyst stains black. Cyst stains black because cyst is having what? Glycogen. Okay. Right. Now, this is, I think, can come in your exam, and it can be an ICT question also. We are talking about this reddish color stuff on this particular culture plate. We are talking about this Tailoromyces marnifi. Tailoromyces marnifi, before it was termed as Penicillium marnifi, and it is producing brick red color pigment. It produces what? Brick red color pigment, and brush border conidal arrangement is observed in this particular dimorphic fungus. In this particular dimorphic fungus, this particular thing is observed. And if they're talking about pigment, na guys, I should tell you this also, the Trichophyton rubrum, which is a dermatophyte, this is also having a red color pigment. Trichophyton rubrum, this can also come. And Trichophyton mentigrophytes, which is there na, in the dermatophytes. That particular fellow is hair perforation test positive, okay, and urease positive. So these are the important ones which I like to tell you. These are the important pigments. As such, there is no specific ones. Otherwise, black and all that, fuoid and all, they are produced in number of other medias also, and SDA also. Okay, but you remember two at least. Brick red on this particular SDA or Tailoromyces marnifi, and another one which is producing this particular type of reddish color pigment, that is the rubrum. And how you can discuss that? Rubbing causes what? Redness. So flavus, aflatoxin release, Malassezia furfur, Tinea versicolor, mucormycosis, that you already know. That is a bacteria, na? Serratia marcescens. That produces red pigment, no doubt. This can also come red, right? You are Serratia, red, double R. Now this parasite, everybody knows about this parasite. It is having falling leaf-like motility. Can you tell me the answer of this, guys? Identify the parasite. This particular parasite, everybody should know. And if you don't know, then you should know it. Okay, otherwise it's difficult for the exam. Answer is? B कौन बोल रहा है? अनिल B कैसे हो गया आंसर भाई? How does the B answer? B पुराने वाले का आंसर अच्छा. I am asking this particular one. What is the answer of this? Answer of this is Giardia. Giardia lamblia. Giardia lamblia is Giradia. Which type of motility? Falling leaf-like motility is observed in Giardia lamblia. It is having this particular shape. These are eyes of it, that nuclei. In between there is an exostyle, 4 pairs of flagella. Falling leaf-like motility is observed in this. Okay, and the question which have come in your FMG exam last time is Trichomonas. Name a protozoa which does not have a cystic stage. Answer is Trichomonas. No cystic stage is seen in this. Important. Naegleria fowleri. Naegleria fowleri is a brain-eating amoeba which leads to a particular ailment termed as PAM. Antamoeba histolytica. Antamoeba histolytica as such causes MBBS, intestinal MBBS, and it also does EIA, extra-intestinal MBBS. The most common site is liver, that is the posterior superior portion, okay, and there is a formation of pus, encovi-sauce pus, and that happens due to the damage to the hepatocytes. And the drug of choice in these particular things, for the intestinal MBBS all is again metronidazole and all. And that depends, pneumonin and extraneumon, diloxanide furet and all is also being used. Yeah, swimming, very right. Selective IgA deficiency, falling leaf-like motility, brain-eating recently Kerala case, okay, of Naegleria fowleri. Tell me regarding this particular fly, which fly it is. As the name suggests, it's a fly. So we are talking about sandfly. This is Phlebotomus urgentipus. It is Phlebotomus urgentipus. That is the sandfly, which is there for the Kala Azar, that you already know. Okay, and important regarding Kala Azar, what I want to tell you regarding that is, In that particular one, what you need to know is that kinetoplast and you go for splenic biopsy and bone marrow biopsy to find the amastigote form, but the infective form is promastigote. Okay, and important regarding that is RK39 antigen card test. Ranbir Kapoor have turned how much? 39 years. Remember like that. And developed Kala Azar. Yeah, sandfly. Redo-It bug. Redo-It bug is for the transmitter for the Chagas disease. Aedes and lice you already know. Okay, so Aedes is number of other vectors like YDRC. Aedes is for what, guys? YDRC. And what is YDRC? Yellow fever, dengue, Rift Valley fever, chikungunya. Okay, and Redo-It bug, that you know. Kissing bug, that is Chagas disease. And now we have talked about that. Again, it have come. This is Redo-It bug. Okay, this is Redo-It bug. Trypanosoma cruzi. It transmits of, does which disease? Chagas disease. Okay, and it leads to that Romana sign, Chagoma, those particular stuff. Megacolon, megaesophagus, myocarditis, meningoencephalitis. Okay, and drug of choice is also important there. That is benzimidazole. Aedes, Zika also. Very right. Zika also. Zika is also transmitted by sexual transmission. Right. Now, another favorite question of examiner which is being asked again and again. This one, and they give up these type of history of the oocyst, and they can give this particular size, that is 5 micron. So it comes in the range of 4 to 6 micron, and we are talking about what, guys? Cryptosporidium parvum, which is the most common cause of what? Most common cause of diarrhea in the HIV positive. This is the most common cause of diarrhea in the HIV positive. What? Cryptosporidium parvum, and having the oocyst size is what? 4 to 6 micron. So that also needs to be remembered. Okay, ji. Now, Cryptosporidium parvum is having 4 sporozoites. That also is important stuff which can be asked. 4 sporozoites are there in that oocyst, and the oocyst size is asked 4 to 6 micron. What is the drug of choice for this? Nitazoxanide. And how does it cause a problem? It causes a problem in HIV positive. Okay, it causes a problem in HIV positive. Cyclospora, Isospora belli. These are also there. Cyclospora is having 8 to 10 or 8 to 12 microns. Isospora belli is having oocyst size of 23 to 36 micron. And one more fellow is there which is in HIV positive cause diarrhea. Microsporidium binusi. So don't forget that particular one. And for these two, cyclo and iso, what is the drug of choice? Cotrimoxazole. Okay. Which coccidian parasite is seen up in this particular picture? They are sickle shaped. Okay, sickle shaped. And the options are these particular ones: bradyzoids, cyst, tachyzoids, or sporocyst. What is the answer? Answer to this question is what, guys? Tachyzoids. They are sickle shaped one, tachyzoids, and rapidly dividing forms that you already know. Rapidly dividing forms are there, these tachyzoids. Bradyzoids are slowly dividing forms, and they are found within the tissue cyst, bradyzoids. So if somebody talks about bradyzoids, tachyzoids and all that, you should immediately think for which particular protozoa? Toxoplasma gondii. Okay, Toxoplasma gondii. What is the definitive host here? Definitive host is cat, intermediate host is rat, and accidental host is men. This also needs to know. Okay, and if somebody talks about them, immediately you should have in your mind regarding the toxoplasmosis. Okay, bradyzoid is a resting form, cyst form, and tachyzoids are found in the blood. They are rapidly dividing forms. They look like this, sickle shaped, and like you have those sporulated oocyst in the soil which are infective. Oocyst as such is not infective. So these are infective forms: bradyzoids, tachyzoids, oocyst. But which oocyst? Which is sporulated, that is infective. Okay. Now, if you are observing up these types of things in a surgery, we are talking about hydrated cyst, which is having daughter cyst, granddaughter cyst and all that, and causative organism is Echinococcus granulosus, also termed as dog tapeworm. And what is the definitive host, guys? Definitive host is dog. Intermediate host is sheep. Accidental host is men. And how does the infection happens? By the eggs. Okay, by the eggs. So answer to this question is Echinococcus granulosus, and which D for D, that is dog tape form, definitive host is dog. Now, if this particular question comes up in which they show up these striations and this particular thing is there lying, we are talking about Cysticercus of the Taenius folium. And what is the full name of it? Cysticercus cellulose. This is a larva of the Taenius folium. Okay, which is termed as arm tape form. This is termed as arm tape form, which looks like a Phillips shaver. That Phillips shaver is Taenia saginata. It looks like exactly a Phillips shaver, which does not have hooks and rostrum. Okay, which does not have hooks and rostrum. So we are talking about this. Answer is D in this particular one. And this Taenius folium is only one which leads to this NCC, neurocysticercosis, and it is eating up the eggs rather than eating up the uncooked pork, which leads to more cases of neurocysticercosis. And most common site in that is subarachnoid, and investigation choice you already know, CT or MRI, and drug of choice for that is albendazole. And before that you need to give the what? Steroids. Now this particular egg they can ask you, and this particular egg is having thickenings and filaments in between their hooks. We are talking about H. nana. Okay, we are talking about what? H. nana, which is also termed as dwarf tapeworm, which is also termed as what, guys? Dwarf tapeworm. And this undergoes what? This undergoes auto-infection. Remember this? This undergoes auto-infection, and this is the smallest tapeworm. This is the smallest tapeworm. Okay. Bile stain or non-bile stain egg? It is having a non-bile stain egg. Neha, that mnemonic Neha. What is the drug of choice for H. nana? Answer is praziquantel. The drug of choice is praziquantel, guys. Drug of choice is praziquantel. All these are frequently asked questions. They are being asked again and again. Now this was last year question itself. Having mucus plugs on this, and this is termed as which particular egg? This is Trichuris trichiura, whipworm, having mucus plugs, barrel shaped, dumbbell shaped, and this is the Trichuris trichiura which associates with rectal prolapse in children. This particular one associates with what? Rectal prolapse in children, and this leads to coconut cake-like rectum. This leads to what? Coconut cake-like rectum. Fine. Now this one, having a planoconvex with tadpole-like larvae. We are talking about Enterobius vermicularis, that is pinworm. Pinworm, Enterobius vermicularis, this particular one, and this is the one in which NIH swabbing is done, National Institute Health Swab. Along with that, important point is Enterobius vermicularis, you need to know that it undergoes auto-infection. Like H. nana, this also undergoes what? Auto-infection. Fine. Now, this one with the blastomeres, 1, 2, 3, 4 to 5 blastomeres with like this, they are the features of hookworm egg. They are the features of hookworm egg, and this hookworm egg is non-bile stained. Okay, non-bile stained. And if you just revise up, Trichuris trichiura egg was having a mucus plugs, barrel shaped. Enterobius vermicularis, planoconvex, having a tadpole-like larvae inside. Ascaris eggs still have not come. Then it will come, I will tell you how does it looks like. So this is hookworm egg, fine. Also termed as Ankylostoma duodenale egg. Now this is the Ascaris egg. This particular one is Ascaris. This is the fertile egg which is having a proper shape. Okay, thick albuminous coat is there. Whereas this particular one is having elongated shape. This is having elongated shape, and this is termed as infertile egg, and this is decorticated egg. Fine. So Ascaris egg. How does the infection of Ascaris happens? By eating up. We have a mnemonic na, for eat. By these eat. Enterobius vermicularis by eating the eggs, Ascaris by eating the eggs, and the Trichuris trichiura by eating the eggs. So these are there in which the infection happens by eating the eggs. Is it fine, guys? I know a bit fast I have to be if I want to cover up important aspects. So excuse me for that. But we need to be slight bit fast. This is another favorite one, banana shaped gametocyte. That is a feature of which particular one? Plasmodium falciparum. And it's a macro gametocyte. It can be a micro also, but the options is written macro, though okay, macro. Banana shaped gametocyte is a feature of it. And sporozoites, that is this particular one. And regarding this particular stuff, Plasmodium, which is the most dangerous, Plasmodium falciparum, okay, and definitely first here is female Anopheles mosquito because sexual cycle happens in that, fine. And regarding the Plasmodium falciparum, already I have told up a mnemonic umber, okay, and in this umber, what all you have, A is all age RBCs are involved up, okay, Morris dots are seen, banana shaped gametocytes are observed up, Ecol forms are seen, recrudescence is there, and the renal failure is there, okay, and the renal failure is there in this particular one. All these are important features of Plasmodium falciparum, okay. Now, this is Wuchereria bancrofti, and this is the microfilaria of it. And as you can see that in the tail tip, there is no nucleus in the Wuchereria bancrofti. And how to remember that? Remember like this, there is a band on the nucleus. And terminal 2 nuclei is a feature of Brugia malai. Okay, Brugia malai microfilaria is having what? Terminal 2 nuclei. That also needs to be remembered. Now, which form of hookworm is this? Which is having a needle-like stuff. And needle-like stuff is a feature of filariform larvae. Okay, filariform larvae is needle-like, and that's why this enters the sole of the foot. In the case of Ankylostoma duodenale, okay, in the case of strongyloids, and in the case of Necator americanus, that is ANS. In all of them, the portal of entry is sole of the foot, like that, ANS. Okay, so this is filariform larvae. This one, this have entered up, see this have entered up into the sole of the foot and could not able to penetrate all the skin layers. That's why you are seeing up here, this is cutaneous larvae migrans, CLM, done by Ankylostoma brasiliensis, and if it is having a history of dog, then it is caninum, and even strongyloids stercoralis, this also leads to larvae currents, which is also a type of what? Cutaneous larvae migrans. And the drug of choice for this is L-bendazole. The drug of choice for this is L-bendazole. Okay? Now this skin lesion, as it is seen, depressions are there. We are talking about umbilicated nodule, and that is observed in Molluscum contagiosum, guys. Molluscum contagiosum, this is a pox virus. This is a pox virus, and mostly they are done by MCV1. MCV2 causes infections in HIV positive ones. So pearly white umbilicated nodule is a typical feature observed in Molluscum contagiosum disease, and important is molluscum bodies, also termed as Henderson-Peterson bodies, which are intracytoplasmic inclusion bodies. They are typical of it. That is the Molluscum contagiosum stuff. Okay. Now, anything which is aggregating like this, multinucleated one, they are becoming up. We are talking about the Zang smear. And Zang smear is done for HSV1, 2, and remember it is also done for HHV3. It is also done for what? HHV3. And what is HHV3, guys? Varicella zoster. That is the chickenpox one. Okay. Now, this everybody knows that the virus responsible is Varicella zoster, that is HHV3, and this is herpes zoster ophthalmicus. This is the reactivation of this herpes zoster ophthalmicus, this one, and single-sided lesion is observed in that, also termed as herpes zoster or shingles, right? And this is reactivation of this particular sort only. Now, this cute child is being slapped, so slap cheek appearance, that is being done by which virus? Parvo B19. This was INI-CT favorite this time. It leads to P for P, pure red cell aplasia. It leads to what? Pure red cell aplasia. Fine. This particular one associates with pure red cell aplasia. Other than that, it associates with aplastic crisis in sickle cell anemic patients. Okay. It associates with NIHF, non-immune hydros fetalis, okay, and polyarthralgia syndrome. Polyarthralgia syndrome, and the question depicts of what, guys? Erythema infectiosum. Okay, erythema infectiosum, also termed as fifth disease, having a slabbed cheek appearance. Okay, having a slabbed cheek appearance. And how to remember that? Remember like this: apne kya ho gaye? Paraye, after a slap. Okay, and what is this A? A is aplastic crisis, P polyarthralgia and pure red cell aplasia, N is NIHF, non-immune hydros fetalis, E is erythema infectiosum. Okay, so these are the important ones which you should know before going in the exam. Now, this particular one is what? Which virus does these genital warts? Obviously, you know it is HPV. And which particular ones? Mainly 6 and 11. HPV 6 and 11 leads to what? Genital warts. Parvo 19, just now we have done. Pox virus, molluscum contagiosum 1, herpes, we have already discussed now. Okay. So, HPV 6 and 11 is this. And 6, 11, 16, 18, they they can lead to CIN and carcinoma cervix also, that you know. And in this, important is this one, E6 and E7. And they cause the loss of which particular gene? It does the loss of P53, and this leads to the loss of RB gene. And these are tumor suppressor gene, their loss leads to tumors. Okay, how to remember? 6, you tilt it, it looks like a P, 7 colors of rainbow, that is retinoblastoma stuff. Okay, so that also needs to know. Okay, the answer is HPV here, human papillomavirus, and it is a DNA virus. It's a DNA virus. This particular Purkinje cells, negri bodies, if this word comes, then there should be no doubt regarding the rabies virus. Okay, what is the speed of rabies virus? Condylom equinatum, you are right, delirium. Okay, rabies virus speed 3 mm per hour. This is the speed of it. Fine. Which particular two places that does not have rabies in India? Andaman, Nicobar and Lakshadweep. Water isolated areas, they do not have it. And that you already know, that furious rabies, dump rabies and all that stuff. Important is from where you take the sample for the antemotum diagnosis. For the nape of the neck hair follicle, this is better one, and corneal smear, and you go for those fluorescent testing here, and you can go for the PCR also. And in the post-mortem ones, you have to go for this brain biopsy from the hippocampal area. In that, you observe these negri bodies, which are intracytoplasmic eosinophilic inclusion bodies. Fine. Now, Nipah, if you are seeing a bat, in the picture, along with the pigs, along with the men standing there, immediately what should come in your mind? Nipah virus. And which state should come in your mind? Kerala. Okay. So, Nipah was there. Okay. So, this is what is Nipah virus, and if these pictures are observed in your exam, immediately you should think for what? Nipah. Can you tell me, Nipah is a member of which particular family? If you tell this, you are about 200 for sure. Let me tell you. If you tell this, it's a, yes, tell in the chat box. It's a Nipah virus, it's a which family member? Paramyxoviridae. It is which one? It is Paramyxoviridae. Fine. It's a Paramyxoviridae having mortality of more than 70%. Now this everybody knows, this is Aedes tiger mosquito, and that leads to YDRC we have just discussed up, along with Zika, which you have told up. Fine. This is a light microscope. And as you can see, they have asked once, where is the condenser? Down is the condenser. Okay, this is eyepiece through which you see, and this is objective lenses. It can be 10x, it can be 40x, it can be 100x. 100x is oil immersion ones. Fine. And these are all common sense things. These are objective lens, this is eyepiece, and this is condenser. Condenser they have asked up once. Now, anything which is spherical, which is filamentous and like that, we are talking about hepatitis B virus. Okay, it exists in 3 forms: spherical, tubular and Dane. Which is the most common? Spherical. Okay, what is the serological marker in the ELISA for the acute hepatitis B? So guys, the best answer is HBs AG positivity along with IgM NT HBC. This is there. Okay, this is acute hepatitis B. More than 6 months, if somebody is HBs AG positive, that is termed as chronic hepatitis B. So that also needs to be remembered. Okay, and if you are getting only the antibody titers against the surface, we are telling that that fellow is vaccinated. And that should be more than how much? More than 10 milli international units per ml. Okay, that should be there, and that is termed as vaccinated. And the vaccine is prepared where? In the East. And 016 is the schedule for it. 016 is the schedule for it, and hepatitis B virus is the only virus which is a DNA virus here. Otherwise, most of them, they are RNA here. Okay, and this time they have asked up regarding the incubation period in the INI state exam. So this can come to you also. Very simple trick is there. Hepatitis A is having the incubation period of 15 to 50 days. Hepatitis B is having 50 to 150 days. Okay? Hepatitis C is having this 50-50 cancels 15 to 150 days. Hepatitis D is same as B, and hepatitis E is same as A. Simple. Okay, 15 to 50 days, 50 to 150 days, 15 to 150 days, and this particular one, hepatitis E, is 15 to 50 days. Okay, so remember this particular one. Like this, you can remember of this. But this 50 is actually what? 45, and this 150 actually is what? 180. Okay, but you could able to recall the things by this 50. 15 to 50, 50 to 150, 15 to 150, that 50 is actually 45, and that 150 is actually 180. And if you remember like that, your things are sorted. Okay. Now, this was asked in the this FMG exam itself, and obviously when you're seeing up GB120, GB41, all these integrase enzymes and all reverse transcriptase, we are talking about which particular virus? Obviously, it is HIV. Single stranded, double stranded, single stranded. Okay, this is a single stranded RNA DNA RNA virus having envelope. This is an enveloped virus. Okay, this is a enveloped virus. Anil, तुम इस बार पास हो, 200 के around हो. Fine. Now this is Zika, and you can see that this particular child is having microcephaly, and the pregnant female, they're having those Hofbauer cells in the placenta which are affected by this Zika, and this is transmitted by Aedes, as you are telling up. Sexual transmission is there of this, and microcephaly. And another important association is GBS, Guillain-Barré syndrome, which strongly associated with which particular bacteria also, that is Campylobacter jejuni. And another one, Mycoplasma pneumoniae. Okay, Mycoplasma pneumoniae also. This is which virus? This is Ebola virus. This looks like a Ebola virus. Ebola virus is the one which needs biosafety level 4. This is dangerous. Dangerous. Okay, more than 50% mortality is there in this Ebola. Zaire Ebola is the most virulent. Ivory Coast is the least virulent. Also transmitted with sexual transmission is seen in this also. Now, this is that famous one which have changed the life of all of us, and that is COVID-19 virus. Which one? SARS-CoV-2. Single stranded, double stranded. It's a single stranded one. RNA, DNA, RNA. Okay. Segmented, non-segmented, non-segmented. Enveloped, non-enveloped, enveloped. Negative sense, positive sense, positive sense. Which particular important virus is negative sense? Influenza virus. Influenza virus is negative sense. Remember that. Okay, and that is segmented also. That is having influenza A, 8 pieces of RNA. That is also important. This is corona. This is SARS-CoV-2. Doing up this coronavirus disease 2019. This particular variant, Omicron variant, what is the number of it? B.1.1.1529. This is the Omicron variant. 1617.2. If somebody writes up like this, 1617.2. This is the Delta variant. Might be asked. What is the investigation of choice? RT-PCR. Okay. RT-PCR. In which particular biosafety levels you do it? That is biosafety level 2. Okay. And what about the culture of it, by which you're able to make the vaccine of it? The vaccines are being prepared up in the BSL-3, C for C culture, है ना? Third alphabet. Then which particular vaccine of ours is using up adenovirus, chimpanzee adenovirus, Covishield, which is having the inactivated virion, that is the Covaxin, okay? Which is the worst vaccine in the world, that is the Chinese one. Sinovac, Sinopharm, they're the worst. mRNA vaccines, Pfizer, they are said to be the best, but God knows what is best, okay? So as this is seen up, that spike proteins and all that is there. So you already know that all these are there in this. Now, this everybody knows, if you're seeing up a bullet-shaped stuff, we are talking about which virus? We are talking about the rabies virus. We are talking about what? The rabies virus, and the shape, shape is that this particular one, and this is the one which is also negative sense. This is also a negative sense form. What is the meaning of negative sense? Negative sense means that firstly it will change to positive sense and then it will replicate. So this rabies virus is also a negative sense virus. Nasal swabbing, and that you know na. Nasopharyngeal swab and oropharyngeal swab you take. Good. What is this, guys? This picture is regarding the autoclave. Okay, an autoclave is which sterilization? It is moist heat sterilization, and more than how much? More than 100? 121 for 15 minutes at a pressure of 15 psi. This is regarding the autoclave stuff. 121, 15 minutes, 15 psi, moist heat sterilization. What is the control used in it? Control is Bacillus stereothermophilus. Okay, that you need to know. Geobacillus stereothermophilus is also another name of it. That is the control used. Frequently asked question, that is. Besides that, what do you autoclave? Sputum samples. Before discard, you have to autoclave. Surgical instruments, certain, you have to autoclave. Okay. Besides that, all the culture medias, all the surgical sutures, except the catgut, they all need to be autoclaved. Fine. Below 100 is inspeciation, pasteurization. At 100 is tyndalization and boiling. Above 100 is autoclaving, and this is moist heat sterilization. Moist heat is better than the dry heat. Dry heat, typical example is hot air oven, 160 for 2 hours, and the control used is what there? Bacillus subtilis and atrophius. Nowadays, if this particular option you would get, Bacillus atrophius, so that should be the answer there in that particular one. Fine. And then you have those incineration, and which particular bags are incinerated, guys? Yellow colored bags are incinerated, and flaming is also one of the dry heat sterilization. Those things which you can't heat, you have to filter them up. Okay, ionizing radiation is which one? The gamma rays and all. Non-ionizing is which one? Those UV rays and infrared rays. Okay, what do you use in blood spills and all? 1% sodium hypochlorite. Fine, 1% sodium hypochlorite. That ethylene oxide gas, which is very highly effective sterilant. It is a high level disinfectant that also needs to be remembered for catgut sutures now, and for the those pre-packed syringes. If somebody asks now which is better, so that thing is better for that. Fine. Pre-packed syringes. Besides that, those names, Riedel-Walker coefficient test, Kelsey-Sykes test, okay, Chick-Martin test, in-use test, they are the test for the efficacy of disinfectants. That also is to be remembered properly. Fine. This is erythroblastosis fetalis, as it is written of. Which hypersensitivity, guys? This is type 2 hypersensitivity. RH incompatibility, erythroblastosis fetalis, along with the autoimmune hemolytic anemias, transfusion stuffs, they all are coming in which particular one? Type 2 hypersensitivity. Okay, along with that, myasthenia gravis and Graves' disease also comes up in the type 2. They have another type, but still they are under what? Type 2 only. That is cytotoxic one. Anaphylactic, you already know that any sort of allergy, that is termed as anaphylactic one. Which interleukin is involved in the type 1? Interleukin 4. Which helper cells are involved up? T helper 2. What is the mnemonic? 1 2 4. Means type 1 hypersensitivity, interleukin 2 and interleukin 4, and which helper cells? T helper 2. 1 2 4. That is T helper 2 cells, they secrete up interleukin 4, which attract which particular immunoglobulin? IgE in the case of type 1 hypersensitivity. Cytotoxic one, the antigen is a part of the cell, to that antibody attaches up, there is a complement activation and complement does the damage. Fine. And in the type 3, that is immune complex ones, the antigen is not bound to any cell surface, it is free, and it attaches with the antibody, produces immune complexes, activate complement, and most of the autoimmune diseases, they are there in the type 3. And typical examples are Arthur's reaction and serum sickness, along with SLE, PAN, all that is there in the type 3. And type 4, sensitized T lymphocytes, that is involved up. They secrete up lymphokines, and there is a formation of granuloma in that. There is a formation of what? Granuloma, tuberculin test, lepromin test, contact dermatitis, a different type of type 4 hypersensitivity. Otherwise, mostly allergies, they are there where? In the type 1. I suppose this particular thing helps. And interleukin 2 plays a role where? Interleukin 2 plays a role in type 4. Okay, and which helper cells? T helper 1 secretes interleukin 2. That is important. Okay. So 1, 2, 4 is for type 1 hypersensitivity. So guys, this much is there. If you revise up this much only, it will touch upon 30 to 40 for sure. And you can very well see up in the exam also that if you have a sound knowledge of this, then you can apply this at a several fronts and all. Okay. And in the last boosting for you, I like to tell this only that it's all the game of mindset. Okay. So it's all here. Nothing is impossible. Impossible itself is telling what? I am possible. So you have to just analyze yourself that where I am going wrong, what should I do in the last days. Okay, if I am having any anxiety issues and all, how to tackle them up, how to go for a wonderful exam on that particular day. Okay, so prepare your strategy for that particular day, that how to go for that and in which way you will go for the exam, and which particular thing firstly you will answer up, and you will not panic if you don't know the answer and all, because that doesn't matter. The question is exam is of two sessions. So even though one session goes down also, you have to score up 150 itself. You can easily score up if one particular aspect is wonderful. Okay, but yes, good going is always good. And I know my personal experience is there, that I have seen up those students who are passing up in the 8th attempt also, and only zeal is that they have not left it. Okay, हारते कब है हम? जब हम छोड़ देते हैं. तो छोड़ना नहीं है, लगे रहो, ठीक है, और अपना बेस्ट दो. And very best of luck from my side. Thank you so much. I hope this particular session is useful for you. So thank you so much from my side, and do revise it up again. Bye.